Namo Namaha. I'm Dr. Aashish Phadke, basically Ayurvedic physician, and apart from that, PhD in yoga philosophy, and I've taken particularly topic on yoga. Today's topic, what we are going to discuss, is in the series of Indian knowledge systems, which has been started by Department of Sanskrit, Mumbai University, on the specific occasion of celebration of Diamond Jubilee. So first, let me thanks Dr. Shakuntala Madam and her colleagues, Mr. Rajesh ji, for helping me in presenting my thoughts in front of you. Friends, today's topic, what we are going to discuss is on critical study of yoga techniques with reference to its clinical applications. So in simplified way, we are going to discuss on what we say, yoga therapy and its current perspective. So we all know that we conduct a lot of yoga techniques like Onkar chanting, Asan, Pranayam, Pratyahar techniques, Bandha, Mudra, Shuddhi Kriya, or Dhyana in various levels at various places, may it be schools, may it be classes, may it be more organized programs like master's level or PhD level. So in all those, we learn these techniques, and nowadays it has been found that people are getting more and more attracted towards the field of yoga, and they are coming to yoga to learn yoga for, usually it has been surveyed and found out that they are coming and getting attracted towards yoga for getting its benefit towards health, may it be physical health or mental health. Okay, but then the funniest thing and the interesting thing, that yoga has never been actually discussed with the basic motto that it can be utilized as a therapy. If we see the real nature or real motto of yoga, is basically for the sake of getting onto the right path of spirituality, right? So in all, with all these background, now we will see exactly uh, how we can go ahead with. So whether there is any direct referencing of therapeutic yoga in any of the texts, or there is a reference of yoga therapy, as mentioned, is justifiable by yogic texts, then already I mentioned that it is not really, it's a byproduct of yoga in the path of spirituality, right? But because we are using that in a very standardized way, in a very innovative way, and a lot of research has been going on this, so it has been accepted worldwide, not only in India, at the global level, and that's how yoga is getting name and popularity. Now, yoga earlier people used to utilize only with disease-centric approach, like yoga for hypertension, yoga for diabetes, yoga for obesity, and things like that. Now also many people, they are practicing that way, but slowly that perception, that thought, that concept is getting slowly changed, and yoga has started taking place with the therapeutic angle, with specific focal point to patients. And now, rather than giving a ready-made say programs for only hypertension, so A B C D E, those asan, those pranayam has to be conducted by all participants. So that is earlier approach, and now they say that okay, this fellow has got diabetes, also hypertension, also another few problems. So the asan practice or pranayam or dhyana mudra, whatever we ask that person to do, has to be tailor made to that particular person's need, and that is what is I mean by patient centric. So now current era, we have got patient centric approach in yoga therapy. Then yoga is used in the therapeutic modality for physical disorders, physical problems, may it be musculoskeletal arthritis, and frozen shoulders and cervical spondylosis and things like that. And also it has been practiced very specifically for psychiatric conditions, psychological conditions, like common like anxiety, stress, then depression and things like that. So yoga is being utilized in various ways. Now coming down to Patanjali Yoga Sutra, which is supposed to be the authentic primary source of yoga literature, then if you try to find out and figure out whether there is any reference of yoga therapy in that, then perhaps you will get answer with no, right? But then in Patanjali Yoga Sutra, if you see a particular discussion on obstacles while achieving this particular path, and that obstacles are being usually termed as antaraya. Okay, antaraya. So there are different types of antaraya. I'm not discussing that because that is not the topic for today. But the very first antaraya which they have mentioned is vyadhi, and vyadhi is nothing but diseases or illnesses, right? Now, in those time, the language of yoga for discussion of diseases and body parts and other aspects was not of modern literature as we can see today. We discuss in terms of modern medicine, but those time it was mentioned and been discussed in their various texts, scripts in the language of Ayurveda. So there is a combination of understanding of the concepts of Ayurveda and yoga together. So in Ayurveda, we have got Vyadi definition as Tad Dukkha Sanyoga Vyadaya. So Dukkha is getting misery is one of the common literary meaning, but dukkha is again made up of two terms, du and kha, where kha is a space and du means deformed or some disturbed. So if there is any disturbed space within the lumen, within the ashaya, within the nadis or within the srotasa, then there is a formation of disease. Okay. Then there is another definition which says that if there is a loss of balance between your dosha, dhatu, mala, agni, and if there is also loss of your balancing of manas and atma, if the atma is not in a blissful condition, then also it is termed as disease condition. So which is opposite to swastha. Swastha is another concept in Ayurveda which denotes holistic health. So samadosha samagnischa samadhatu malakriya prasanna atma indriya manah swastha iti abhidiyate. So very first line speaks about physical health and the next line speaks about psychological and spiritual health. So vyadhi is with reference to that, and in that way, in a remote way, they have also discussed about therapy in that sense. Okay. But if you go to further other literature like Hatha Pradipika, for example, Giranda Samhita or Shiva Samhita or Goraksha Shatak and many other Hatha Yoga texts, then you can see that in those particular texts, you can see the direct reference for the therapy per se. Now see this particular shlok that danda dvayam kapale dve adau pitha chatushtayam vaishamyam saptadatunam nashayanti murtata. Now here they are specifically mentioning that if we follow these upper first line practices of yogic practices, then what you can see that it removes the vaishamyam, it removes the imbalance between the seven vital tissues, which are rasa means lymph, then rakta means blood, then mausa means muscle tissue, okay, meda means adipose tissue, that is fat, asti, that is bones, majja, that is bone marrow or nervous tissue, and finally shukra, that is reproductive tissue, that is sperm and ovum together. Okay, so it removes Sapta Vaishamyam of Saptadhatu, but then in Jyotsna Tika, written by Brahmananda Swamiji, he has mentioned that it is to be understood that Saptadhatu means not alone these seven vital tissue, but also one should consider Dosha, Dhatu, Mala, and Agni as mentioned by Ayurveda. And if we understand in the holistic meaning of this particular sutra or shlok, then you can understand the meaning in a rightful way. And that is the key of knowing and going ahead in a right direction in yoga therapy. If we just read the translations in English or Hindi or vernacular media, Sometimes we miss out on that. So we need to read Sanskrit in original along with the help of our ancestors, those who have written commentaries. Okay, now there is another example which comes from same Hata Pradipika only, is 18 shlok, first chapter, that swastikam gomukham viram chittam chanchalya nashakam nivritte sarvaroganam lagu kurmam cha kukkutam. Now these particular asan practices, that is swastikasan, gomukhasan, virasan, they are otherwise we practice and otherwise we have been taught about it for other benefits. But if we read this script in original, then you cannot miss out this, and which I have made it bold in blue, that it is chittam chanchalya nashakam. So it removes the anxiety, or it removes the removing wavering nature of chitta. Then this is very specific. Then nivritte sarvaroganam lagu kurmam cha kukkutam. If you perform kukkutasan and lagu kurmasan, then it will help you to get rid of all kind of diseases. So these kind of direct indications, these kind of direct directions with reference to yoga therapy has been already mentioned. Now, the next question comes whether the yoga therapy has been advocated. Then if it is advocated, for whom? Who can practice yoga and yoga therapy in bracket? So it is again very clearly mentioned by Hata Pradipikakar that yuva vruddhopi vruddhova vyadhito durbalo apiva. So it can be practiced by young adults, it can be practiced by senior citizens or very old senior citizens at the age of 80s and 90s and things like that. Or also it can be practiced by those who are bedridden, those who are suffering from diseases. People like having diabetes, people are having like hypertension, or even people those who are bedridden after having bypass surgery, CABG, or people lying down on bed with cancer. Even those, and those who are very very weak. Okay, in the last few years you might have seen that many people in the ICUs, many people in the these isolation wards of COVID-19, they have practiced yoga and got tremendous benefit. So it can be said to be beneficial for patients and those who are in convalescence period and those who are very very weak. Okay, for them also. And how it can be done? So it need not be na vesha dharanam siddhe karanam nacha tatkatha. You need not only wear particular probe and robe, and then only you should practice. Anyone can do. The only very important part is that one should practice in a real way every day regularly and with faith on the particular shastra. Okay, so if you do so, then you will get definite result. That is what promise Shastrakars are giving. Now I'm coming down to certain examples from Asan. If time permits, we can speak a little bit on pranayam later and we can wind up today's session. Now take example of the very common Asan practice, that is Padmasan. Now how it is to be get into Asan practice, you are aware, right or left, those legs should come and it will form like a shape of lotus flowers. So Padma Asan, that's the name. So once you sit in this, then in the Falashruti, in the benefit of this particular asana practice, Shastrakar is saying, Etad Vyadhi Vinashakari. So it removes all kind of diseases, it destroys all kind of disease, right? So it will be interesting to find out how it can be considered to be same result. So one Mr. Pratap V and his team, they have taken 12 yoga sadhaks to sit in a particular yogic posture Padmasan compared to non-yogic postures. So 12 people were sitting in yogic posture and the other were sitting in non-yogic postures, and then they were screened with certain criteria with the battery of tests, and then it has been found that there is a significant reduction in their respiratory rate. Our common respiratory rate is around 16 to 18, or sometimes even lesser than that, 14 to 18. So the respiratory rate, once you sit in Padmasan, it was found out to get reduced. Okay, apart from the increase in their stability. Now here, the stability is not just physical stability, but apart from physical stability, they were found out to be more specific in their cognitive stability. grasping as well. Okay. Now, if you pay attention to this particular figure of this Padmasana, then you will see that it is a triangular shape. So the base is of both legs, and then on the top there is a head and there is a triangle. So it's a stability giving asana posture. Similarly, you see swastikasana. Actually, we start with sukhasana, then one leg inside, then it becomes swastik. Then you go for ardha padmasana, then padmasana, and then siddhasana. So that is the way we go ahead with meditative postures. So in swastikasana, this is the way which is mentioned in Hatha Pradipika. I don't read this, but the muscles of the both lower extremities, the flexors, are greatly contracted and pressed. Now, what are flexors? Flexors are those muscles which are on the inner side. Now, these are flexors of my hand. Outsiders are extensors. So, flexor, when they act, it will help limb to fold. So, similar way on the thigh, inner part of thigh, they are flexors. So flexors are greatly contracted and pressed when you sit in swastikasana. This circumstance, coupled with passive control of all muscles of the lower extremities for a considerably long time, interferes with the free current of blood circulation. So just see, when you are sitting like this, the free current of blood flow will be arrested for some period. Okay, and that being the case, the pelvic region gets the larger blood supply from the abdominal aorta. Now here, again I can show you, here from here it comes down the abdominal aorta, and if a person is straight, then it will come down, but here it is arrested, and that blood supply is made available to pelvis or pelvic floor in that case. Okay, this facilitates toning up of coccygeal and sacral nerves. So that's how it is making result or effect on the nervous system also, right? Now coming down to other aspect, that uh, this particular adductor and pubofemoral ligament are not stretched extensively, and the knees and hip joints are not placed under intense torque when you're sitting in this particular portion. So this is another observation mentioned by a person who is writing in 2010. Okay, whereas the earlier was reports from one of the paper from 1928. So people are working and extensively studying this. Now coming down to these meditative postures, now we have got a lot of meditative postures, like you have got Sukhasana, then Swastikasana, then Ardha Padmasana, Padmasana, and then Siddhasana. Siddhasana is supposed to be the last and the difficult one. Now in this, what is very important, what already I have mentioned, that it is triangular shape, the head is on the top and the legs are on the base. Okay, it gives steadiness and ease. So the definition which we have learned from the Patanjali Yoga Sutra, what is asana? So asanam sthiram sukham asanam. So that sthiram and sukham is established in this particular way when we sit in that particular way. So if the pelvis and legs are arranged in this way, that clearly supports the spine, and spine can then be supporting for the skull, and the spine and skull can together protect the brain and spinal cord. So you understand, when it is particularly taken this position, the brain and spinal cord is been taken into consideration and they get support and protection. Now this nervous system can register this sense of support and ease, and it turns its attention to practices such as other than just balancing the body, and that is what is pranayam and dhyan. And that's how very beautifully it has been mentioned in the may it be Patanjali Yoga Sutra, may it be in Hatha Yoga practices, that unless and until you don't do asana practice correctly, you should not venture into pranayam or dhyan, right? Because it is required to have the proper practice of, or the siddhi of asana siddhi, right? When the spine is supported efficiently by pelvis and leg, the ribs are also free to move with that of breath, and rather than becoming a part of support system mechanism, right? And therefore the posture, in this particular posture of the position of the cross leg, that allows the weight to fall most clearly from the spine through the pelvis into the sits bone, that is symphysis pubis, and support the floor. And in this way, a minimum amount of muscular effort is needed to align the bone for the support. In this, you see the normal curvature, S-shaped curvature of your vertebral column and spine is maintained. So a well supported seated asana, the intrinsic equilibrium of the pelvis, spine and breathing mechanism supports the body, and the energy that has been liberated from the postural efforts can be then focused on a deeper process like pranayama or meditation. So beautifully, we can understand how the mechanism of that particular posture helps physiologically as well as anatomically, right? Now coming to another asana, that is Paschimottanasana. Now in Paschimottanasana, how it is to be done, everyone is aware of, so I'm not saying that. But what it is making difference that iti Paschimottanam asanam agriyam pavanam paschima vahinam karoti. So the prana or the vayu, which is in the front side when you are inhaling and exhaling, it is usually coming from the front. It makes that vayu to go on the back side. Paschima is Parshvata, Agrata and Parshvata. So Paschima Vainam is, it makes it to go posteriorly. And then also it helps in Udayam Jatranalasya Kuryat, Udare Karsham Arogatam Cha Punsam. So it also helps to facilitate to enhance Jataragni. So Jataragni is a digestive fire within our body, right? Or it's a metabolic capacity in a modern terms, right? Then it also helps to reduce the belly or the fat, the tires which you have. Okay, and then uh, by the virtue of it, by the increase of Agni, it will make that human being get disease free. Arogatam cha punsa. Okay, because in Ayurveda there is a concept that if there is a mandagni, if the digestive fire is bad, it is low, then that is the start of all kinds of diseases. Sarve roge pi mandegno. That is the sutra in Bhratrai. So if the Agni has to be restored properly, then apart from taking any medicine, if someone does only Paschimottanasana correct way, then it will be really helpful. And it is difficult asana, so it is also termed as Ugrasana in Giranda Samhita. Okay. Now coming down to records put by Swami Kulanandaji in 1926, who happens to be a founder of Kaivalya Dham, the very famous institute at Lonavala, Yoga Institute at Lonavala, right? So he has mentioned in his paper that this posture, nearly all posterior muscles of the body and particularly of that of hamstrings is a calf muscles, are fully stretched, and later on when you are getting into posture it gets relaxed. Now the front of the abdominal muscle, especially the two recti, that is these two recti, okay, they are rectus abdominis, are vigorously contracted, which ensures better health and functioning for them, because it helps in again aggravating or it helps in enhancing or increasing Jataragni, right? But a yogi culturist can be by practice relax them completely and may then take to Uddiyan during this pose. So once you attain this particular pose, then slowly it will get up, having automatic Uddiyan in very seasoned yogis, not the yoga sadhak like you and me who are practicing with efforts. Okay, the side muscles like psoas major, psoas minor, iliacus are very vigorously contracted and stand in the same condition throughout the posture. And all these contracted muscles strongly compress the abdominal viscera, abdominal contents, may it be stomach, may it be liver, may it be spleen. In this posture, the lumbosacral vertebrae are posteriorly stretched, because once you bow down, then the lumbosacral vertebrae in the vertebral column, they are posteriorly stretched out partly. Nerves supplying to pelvis organs and arising from the lumbosacral region are toned up because of the lumbosacral part of the spine, and consequent richer blood supply brought to that particular part. Now, see, this kind of observation was mentioned by Swamiji way back in 1926. So, when we see today's teaching of yoga therapy in various programs, we wonder why we are not making use of this kind of observations. Okay, but one should know that when I teach my students, I make sure that they should know both modern side, the ancient wisdom, and the tika, if available, of those particular main scripts. Now, coming down to another observation by Gharote and team from the same Kaivaladham group, they have found that it can be done in four variations, and these are four variations. That is Paschim Tanasan, as we usually do in sitting, then Ardha Paschim Tanasan, that is Mahamudra, which again we all aware of. Then there is another form that is in lying down position, that is Shahita Paschim Tanasan, and then Uttana Paschim Tanasan, when you stand up and do like Hasta Padasan, yeah, right? And you try to touch your forehead to your knees. So that is Uttana Paschim Tanasan in standing position. There is a rise in intragastric pressure and in all these, and that is minimum is 3.5 mm of Hg in Ardha Paschim Tanasan and Shahita, whereas maximum of that of 5 mm of Hg in Uttana, means in a standing, it is max. Okay, and in one subject during 8 observations, so that they have tried to do experimentation with the help of doctors and gadgets, and they found out. Now pneumographic recordings and blood pressure did not show much changes. If you make sadhak do these kind of practices with recording of blood pressure and pneumographic techniques, then there is no much of the difference in this, right? uh, this is indicated that these variation of Paschim Tanasan did not differ significantly from each other. So one can do Paschim Tanasan in a sitting easily, and this is one of the experiment they did, and that has been utilized for the therapy later on. So this becomes a base for all of us to understand what kind of variation to be utilized when, and if there is no difference, then you can go ahead with any of them, right? Now coming down to another important observation by Dr. Gore, Gore and Bole, Dr. Bole, MV Bole, again from the Kaivalyadham group, that they have demonstrated that heart rate increased by 32% when it is practiced, Paschim Tanasan is practiced with an isometric base, by 13% when it was repeated 4 times with an isotonic base, and only 6% when it was performed in a relaxed manner as a posture for 1 minute each. Now there is something like isometric, isotonic. I'll show it in the next slide. But just understand that when you are exerting different tension, then it is you are changing the tension, but the measure of the muscles are same, so isometric. And when the tension is same and the muscle go on changing, then it is isotonic, but the measurement becomes different. So ideally, when it is to be practiced in a relaxed manner, then it exerts only 6%. So that is advisable in specific, most of the cases rather. So this is that isotonic and isometric. I said metric means the length is same, but the tension changes, where here tension is same and the muscle length differs, right? So these are specific technique used by physiotherapists coupled with yogic practices. Now coming down to Bhujangasana, usually we are looking out Bhujangasana with a very limited resource and limited view. That Bhujangasana, oh, we know Bhujangasana Cobra pose, and it is useful for what? Low back pain. Fine, agreed. Okay, but if you see uh, the basic text, what it is been mentioned in the basic text, like Dehagni Vardate Nityam Sarva Roga Vinashanam. So by being in this particular posture on a on abdomen when you are lying down and raising your torso up like a cobra, but you raise your torso only up to your navius, only up to your umbilicus, and then there is a slightest pressure on this zone, and that helps in igniting the Jatragni, which we are saying again and again earlier as well. So Dehagni Vardati Nityam. Now they have not mentioned Jatragni Vardati Nityam. They have said Dehagni. So there is a difference between Jatragni and Dehagni, and that can be only understood if you understood some of the basic concepts in Ayurveda. So Ayurveda says that Agni which are there in our body, they are of 13 types. So one is Jatragni, which is the main one, and then there are Pancha Bhutagni, Mahabhutagni, and then Sapta Agni. So total there are 13 types of Agni, and all of them can be enhanced by doing this practice, because Jatragni is getting ignited, and that helps to ignite other Dehagni. Okay, and once the Agni is raised and in a proper balanced way, then it will Nityam Sarvam Rogam Vinashanam. Then it will take care of all disease. It will destroy all kind of disease. Now coming down to another aspect of it, that usually, as mentioned earlier, it is useful for low back pain, and everyone is practicing this particular posture for low back pain. But it is also useful in a specific indications. For example, spondylosis. For example, lumbar spondylosis, lumbar spondylolisthesis, whereby the disc, intervertebral disc, is not completely removed. It is slightly removed. So it is spondylolisthesis. Then there is a prolapse intervertebral disc when the disc is removed, right? Or a prolapse, so PID. So in various ways, we can use this particular asana posture. Okay. Now, if we do like this, and in most of the schools, like in Kaivalya Dham, in Yoga Vidya Niketan, from where I have learned my things, we ask sadhak to raise only up to navius and leave your hands, and you should not fall down onto the ground. If you can do so, you are doing the right way. But if we are raising too much, like this, in the other side, the boy is doing, the male is doing, this is also one of the institutionalized practice. You have a series of Bhujangasana in some of the other yoga institutes, very famous institutes across the India and world. But then the pressure point changes. Here it is different, here it is different, and the force is also different. So one has to be very careful in choosing which kind of modified practice we are utilizing with. Okay, then Bhujangasana maintain in a relaxed manner after deep inspiration. So once you take inhalation and then you maintain, then it is increasing stomach pressure or abdominal pressure by 12 mm of Hg. And while exhaling completely, if you maintain it, then it is creating negative pressure like minus 2 mm of Hg. So that it has been also recorded, and normal inspiration and expiration revealed pressure in between these two values. So again, these things to be kept in mind while giving this particular advice of Bhujangasana to patients. If a person is healthy, still it is okay. But when you are dealing with patient, then you need to be very careful. Now, Dr. Bole and team, they have also seen that there are variations in methodologies in adopting with different diseases of the very same Bhujangasana. For example, if a person or the patient having high BP would be advised to do Bhujangasana under exhalation or after exhalation, okay, so that it will not tend to increase BP and will not exert strain on the heart. So very minute observation, very useful clinical indication which has been seen in this particular paper. For patient having respiratory problem like emphysema and things like that, it is advisable to do practice after deep inhalation. Rather, they should do after exhalation. Okay, so they should not do after deep inhalation, but they should do after exhalation. Patient with the problem of packets of alveoli collapse, already there is a collapse, and having poor ventilation like COPD, chronic obstructive pulmonary disorder, we call, should do this practice with deep inhalation and continuation of deep breathing in the final pose of asana. So friends, we have seen up till now few asana practices, and we were discussing on Bhujangasana. And likewise, there can be many other asana practices which can be discussed and described with specific reference to yoga therapy. So with so that of we can also conduct sessions separately if possible with that of yoga therapy and pranayam, right? Do's and don'ts of pranayam or dhyan, something like that. But at the moment, I would like to rest here only. I would like to thanks my Guruji, late Padma Shri Yogacharya Nimbalkar Guruji from Yoga Vidya Niketan, and all my senior yoga teachers those who have taught me and introduced me to field of yoga. Also, all teachers from philosophy department and Mumbai University, where I had my post graduation in yoga, and Dr. Shri Krishna sir from Kaivalyadham, Mumbai. This is Chopati branch, and Shri O.P. Tiwari ji sir from Kaivalyadham, and Dr. Ganesh Rao sir, because he also taught me and made me understand in a depth various aspects. I also thanks to my mentors, Dr. Vaidya sir and Vaidya madam from KHS MRC, where I'm working as a deputy director, and they gave me vision of working in a yoga research. I also thanks to all my students to whom I have taught yoga and yoga therapy at different institutes, all my patients on whom I have used yoga as a therapeutic modality, all the authors and editors of various journals and texts from whom I have borrowed these particular references in this particular presentation, and my parents and my better half who always supported me and encouraged me to learn different disciplines. And not last but least, all the August gathering, those who are listening to me such a long time, and particularly Dr. Shakuntala ma'am, head of the department. Dhanyavad. And I wish that Sarve Santu Niramaya, Sarve Badrani Pashantu, Ma Kaschit Dukkham Apnuyat. Let everyone learn yoga. Yoga now, no stress, and no yoga, lot of stress. So let us learn yoga and take our life towards betterment. Dhanyavad. Thank you.